So in this video, we'll be majorly speaking about the urinary tract infection, also commonly referred to as the UTI. So the UTI is an infection that, as the name suggests, majorly affects the urinary tract. It is majorly caused by bacteria, but also some strains of fungi can also cause urinary tract infection. The urinary tract majorly comprises of the bladder, the ureter, the urethra, and the kidneys. There are some organisms that are able to colonize the urinary tract, but they manifest with no signs and symptoms. And when a test is done, the organisms appear in the urine test and even microscopically. These organisms are commonly referred to as the normal flora. So the normal flora, actually, they are organisms that help the body cohabits with them, and the relationship between them and the body is such that they are able to protect one from foreign infections. So the females are the most commonly affected people in regards to UTIs, and they are affected in the ratio of about 4:1 in comparison to men. And it is said that about 40 to 60% of women always have a urinary tract infection along their lifetime. So right away, let us go to the signs and symptoms of urinary tract infection. The very first sign and symptom is the disuria. So disuria is actually defined as pain or a burning sensation when you are urinating. This pain happens due to irritation of the lower segment that is caused by bacteria. The next sign and symptom that we'll look at is urgency to urinate. Actually, the urgency to urinate is increased when somebody is manifesting with UTI. This is because of the bacterial irritation in the blood. UTIs may also present with discharges. The next sign and symptom is increased frequency of urination. The urge to urinate increases over time, and this leads to several trips to the washroom. Even when the bladder is empty, you will always be feeling the urge to urinate. There is also a foul-smelling urine that may occur when you have UTI, and this is due to WBCs and the pus that are formed by the bacteria whenever this infection is active. Somebody may also manifest with a type of pain that we refer to as suprapubic pain. The suprapubic pain is pain in the pelvic region of the body. There is also what we call hematuria. Hematuria actually is the presence of blood in urine, and this may be sometimes very visible with the naked eye, or sometimes you cannot see it with the naked eye, and it might require microscopic or biochemical test to determine if there is some presence of blood in urine. The presence of blood in urine takes place due to the trauma that the bacteria causes in the urinary tract. The next sign and symptom that we look at is urinary hesitation. Urinary hesitation is whereby you have difficulty in initiating urination, and also sometimes you have a difficulty in maintaining the urination. Urinary tract infection sometimes attacks the lower part of the urinary system, that is the bladder and the urethra, but sometimes when it affects the upper part, that includes the ureter, and it also moves to the kidney, this is a condition whereby we refer to as pyelonephritis. So pyelonephritis is an advanced form of urinary tract infection that sometimes is caused by bacteria moving from the lower urinary tract to the upper urinary tract. Sometimes this can also happen when there is systemic infection like septicemia, and the blood that reaches the kidney infects the kidney with bacteria or bacteremia that is found in the blood. So pyelonephritis, it is an advanced form of urinary tract infection and should be taken keen and should be treated. It manifests with the following signs and symptoms. Number one is flank pain. The second sign and symptom that it manifests with fever and chills. Somebody presents with fever and chills, and these fever and chills majorly occur due to the body trying to fight away the infection. And also when you do a full hemogram, you will find that the person manifests with a high amount of neutrophilia, and sometimes there is vomiting. So this is an advanced form of urinary tract infection. The treatment for urinary tract infection is majorly done by antibiotics, and depending on the severity, somebody can go for the oral antibiotics or sometimes intravenous antibiotics. How do we actually prevent urinary tract infection? Of course, you can take in a lot of water and a lot of fluids. You can take in a lot of fluids. Rehydration is a major way of preventing urinary tract infection. Proper wiping techniques for the ladies. You properly wipe from front to back. Some contraceptives like the spermicidal agents, they act as a predisposing factor to urinary tract infection. So by avoiding them, you can be able to prevent urinary tract infection. You can also urinate after sex to prevent, to clear off the bacteria that are always around the urinary tract. Bacteria that cause urinary tract infection include bacteria like E. coli, the pathogenic strains, the Proteus, and the Enterobacteriaceae. So all these bacteria, they are normal bacteria that are found in the intestinal tract, and when they cross over to the urinary tract, they act as pathogens. They act as disease-causing microorganisms. So how do we diagnose UTI in the laboratory? So the first test that we can do for urinary tract infection is performing a general urinalysis. A general urinalysis, and you can watch my previous videos on urinalysis to get more about how the urinalysis procedures are done. So if we see that there is the presence of leukocyte esterase in urine, we therefore start querying urinary tract infection. Also, when the nitrites react, then we will start querying gram-negative bacteria that are found in the system, and these gram-negative bacteria include bacteria like Enterobacteriaceae. Can also do microscopic examination of the urine for the presence of pus cells or WBCs, and also we can check for the presence of WBC casts that are passed in the urine. Microscopic examination can also reveal the presence of RBCs in the urine, and when RBCs are present, then we start querying hematuria. We can also do culture and sensitivity, which is a more specific test, and we can actually isolate the type of pathogen or the type of bacteria that causes the urinary tract infection. Sometimes urinary tract infections are caused by fungal. Candidiasis can be diagnosed by performing culture on the urine sample. When the culture grows, we can perform a further test called the germ tube test. So that was it. That was a brief video on the signs and symptoms of urinary tract infection. Thank you for staying with me, and indeed, if you like the video, you can hit that subscribe button, like, share widely, and that was George's Solution. Bye.